Moving now to health news. An advisory panel to the FDA now says a common ingredient in cold virus medications, phenylephrine, does not work. As we lean into cold virus season, the question becomes, what should we do to treat the symptoms of the common cold? Well, why don't we ask a doctor? Our medical expert, Dr. David Winter, joins us to discuss. Thank you, Dr. Winter, for joining us. And let's start right there. What do you recommend to treat symptoms of that common cold?
Well, Chris, first I think it's important to know what you're treating. You take a common cold, influenza, COVID, strep throat, they all have different treatments. So it's important to know what you've got going on. Symptoms can help. Prominent sneezing suggests allergies. Bright red, very sore throat, that's a streptococcal infection. We call that a strep throat. COVID typically has head congestion, muscle aches, soreness. And an influenza has very mild congestion, but a lot of muscle aches, a lot of fatigue and fever. Now, the best thing to do is just get a test. If you know what you're treating, that'll work better. Doctor's offices, urgent care centers, you can get over-the-counter testing kits. Get a diagnosis first, and your treatment will work out better.
Okay, so let's talk about phenylephrine. What is the issue there? Is it still available in pharmacies? And why is the FDA challenging its use?
Yeah, there's nothing bad about phenylephrine. It doesn't have any side effects in particular, but it just doesn't work very well. When you take phenylephrine by mouth, the liver breaks it down so very little gets into the bloodstream. If you have heavy congestion, need a decongestant, pseudoephedrine is still out there. Pseudoephedrine is the name. You don't need a prescription for it, but you need to have a driver's license to show the pharmacist before they'll give it to you. So phenylephrine, it's in a lot of medicines right now. Those medicines work for you. They have other ingredients that's making it work, so you don't have to throw those away, but it'll eventually probably be taken off the market.
Okay, you said pseudoephedrine. What other treatments will work for those nasal, stuffiness, head congestion type symptoms? Yeah,
a lot of things can work for that, Chris. A hot shower works. Take a wash rag, very hot or very warm water, put that over your mouth, your sinuses, that works. Drinking lots of water is important. Cough medicines typically have guanfacine in it. That thins the secretion. You clear those better. Then you have nasal corticosteroids that work. A lot of folks like to kind of rinse out the nose also with saline sprays or even regular water. One caution there was a guy who was using tap water to rinse out his nose and got an amoeba infection into the brain. So if you're going to use regular water, distilled, sterile water, or boiled water. But a lot of things work, Chris.
There's something I've been told since I was a kid works. Chicken soup. I've heard it's good for the soul. Does that work? Classic home remedy.
I happen to have one right here, Chris, and indeed it does work. A study came out in 2018 that showed that it did work better than placebo. So I'm not sure what the ingredient is, but chicken soup also works very well. Now, ideally, though, you want to prevent getting things in the first place. So be careful in crowded indoor settings. And if you get sick, do the world a favor, do your community a favor, stay home. These things spread through the air. So we want to try to decrease the spread of infections this fall.
Stay home and eat your soup. Thank you very much, Dr. Winter, for joining us today.
Thank you.